Thank you, Chairman Mervin and Ranking Member Rosendale. I really appreciate you agreeing to allow me to join today's hearing. I have the honor of representing Mann Grandstaff, and I think we all agree that achieving top-notch veteran care is the #1 priority in everything that we do. And I am committed to doing everything that I can to make sure that this transition to the electronic health record is successful. I'm very excited about what it could mean. It's been a long time goal. And so I appreciate all the work that's been done. I appreciate all of you on the committee. I know many of you have traveled to Spokane, and everyone is committed to assuring that we have a successful rollout and modernization of the electronic health record. I want to thank Dr. Fisher, who is the director. He was on here just a little bit ago, but boy, he's been on the front lines. And as the director of Mann Grandstaff, and just doing all of this in the midst of a pandemic is not easy. And I also want to thank Cerner, who has been very engaged with my office in sharing information and answering questions about the situation on the ground. We all share the goal of making sure that this electronic health record modernization serves our veterans and serves them well. So I had a few questions that I wanted to be able to ask today. I'll start with Mr. Sandegger. We are getting specific complaints in my office about the electronic health record at Mann Grandstaff. And one of the most common complaints right now is about the prescriptions and the patient portal. And I understand that any new patient portal is a big adjustment, but anything that impedes people from getting their medication and getting their accurate medication is dangerous. And what I'm hearing is that the wait times for the call center, which is the workaround for the veterans who are struggling to refill prescriptions in the patient portal, are too long. As another workaround, the medical center employees are sending veterans to urgent care to get a 30-day refill of prescriptions. So I'd like to ask, just what is Cerner doing now, and what does Cerner plan to do moving forward to solve these problems with the patient portal so that veterans get the prescriptions that they need and when they need them?
Thank you, ma'am, for the question. I appreciate it. And thank you for your and your staff's support in making sure that we do get feedback on the ground and that we can quickly address that. To start with the prescription feedback, as alluded to earlier with the medication migration, making sure that clinicians were able to get through that medication reconciliation quickly. And identify the meds that need to be renewed, shortening that workflow, improved accuracy for the providers in their prescriptions. Secondly, we also held a number of what we call favorite spares, which is just working with providers on here are the medications that you order for veterans most frequently, and helping educate them on the fastest way to go do that, so that they can reduce the time it takes them to order. And we've seen a significant drop in the time to order meds from the initial go live until now. I personally met with the pharmacy director along with all of a lot of the providers on the ground when I was out there. And those improvements right off the bat are immediately seeing results. The number of error in prescriptions has gone way down. The pharmacy's been tracking that. In addition, ma'am, to your question on the wait times, we do track wait times both for clinical staff calling in to our clinical help desk, as well as for veterans calling into what is on the commercial side called our consumer help desk.
Okay, very good. I just want to try to get in another question here too, because the Cerner system, we're getting complaints that it's starting to freeze up more often. And I know, I understand that these are very large patient files and the history being loaded. But the VA has spent millions of dollars to replace computers and upgrade the infrastructure per Cerner's specifications. So I just wanted to ask, are there further upgrades, whether hardware or software adjustments needed?
We will continuously upgrade the system. We have upgrades scheduled, every 6 to 12 months. We're constantly taking new code to make sure that the system's always modern. And we'll absolutely look at any of those transaction response times. If there's any freezing in any workflow, we're constantly working to optimize that. Yes, ma'am.
Okay. Thanks again. Good to be with all of you. I yield back.